Bismillahirrahmanirrahim. Assalamu alaikum. This is Rimla Zafar, student of third year pharmacy evening. The topic on which I am going to discuss about is the urine analysis. Before starting urine analysis, I want to discuss little bit about Surah Khaf. Ayat number 27. ترجمہ اور تلاوت کرو جو تمہارے رب کی کتاب تمہیں وحی ہوئی اس کی باتوں کا کوئی بدلنے والا نہیں اور ہرگز تم اس کے سوا پناہ نہ پاؤ گے۔ تفسیر۔ اپنے نبی صلی اللہ علیہ وسلم تمہارے رب کی کتاب میں سے جو کچھ تم پر وحی کیا گیا ہے اسے چوں کا توں سنا دو، کوئی اس کے فرمودات کو بدل دینے کا مجاز نہیں ہے، اور اگر تم کسی کی خاطر اس میں رد البدل کرو گے تو اس سے بچ کر بھاگنے کے لیے کوئی جائے پا نہ پاؤ گے۔ آیت نمبر 28۔ ترجمہ۔ اور اپنی جان ان سے مانوس رکھو جو صبح و شام اپنے رب کو پکارتے ہیں، اس کی رضا چاہتے، اور تمہاری آنکھیں انہیں چھوڑ کر اور پھر نہ پڑیں کیا تم دنیا کی زندگی کا سنگار چاہو گے اور اس کا کہنا نہ مانو جس کے دل پر ہم نے اپنی یاد سے غافل کر دیا اور وہ اپنی خواہش کے پیچھے چلا اور اس کا کام حد سے گزر گیا۔ تفسیر۔ اور اپنے دل کو ان لوگوں کی مائیت پر مطمئن کرو جو اپنے رب کی رضا کے طلبگار بن کر صبح و شام اسے پکارتے ہیں اور اس سے ہرگز نگاہ نہ پھیرو۔ کیا تم دنیا کی زینت پسند کرتے ہو؟ کسی ایسے شخص کی اطاعت نہ کرو جس کے دل کو ہم نے اپنی یاد سے غافل کر دیا ہے اور جس نے اپنی خواہش نفس کی پیروی اختیار کر لی ہے اور اس کا طریقہ کار افتراق اور تفتیت پر مبنی ہے۔ حدیث۔ اللہ کے رسول صلی اللہ علیہ وسلم پر جو شخص ایمان نہ لائے اور ان کے لائے ہوئے دین کو اپنا دین نہ بنائے اور وہ نجات نہیں پا سکتا۔ ترجمہ۔ حضرت ابو ہریرہ رضی اللہ تعالیٰ عنہ سے روایت ہے، وہ رسول اللہ صلی اللہ علیہ وسلم سے روایت کرتے ہیں کہ آپ صلی اللہ علیہ وسلم نے فرمایا، قسم اس ذات پاک کی جس کے قبضے قدرت میں محمد کی جان ہے، اس امت کا یعنی اس دور کا جو کوئی بھی یہودی یا نصرانی میری خبر سن لے، یعنی میری نبوت اور رسالت کی دعوت اس تک پہنچ جائے اور پھر وہ مجھ پر اور میرے لائے ہوئے دین پر ایمان لائے بغیر مر جائے تو ضرور وہ دوزخوں میں ہوگا۔ Let's start our topic, urine analysis. Urine analysis is basically the urine test in which we will be examine or visualize the chemical and the microscopic features of the urine. Urine analysis is comprising of two parts, macroscopic features and microscopic features. Macroscopic features are those which will be seen with our naked eye, and microscopic features are those which we can study only in microscope. Doctor prescribed to perform the urine analysis in order to check out the different types of diseases which will be patient have, like having diabetes related ketoacidosis, high levels of protein, high or low levels of protein, glucose in urine, and many other more. For example, if a patient have a UTI infection, then the urine color will be cloudy instead of clear, and if the protein having present in the urine, then it will be show that the kidney disease. What's the purpose of urine analysis? In order to check out the overall health, whether the patient is healthy or having a disease. Urine analysis is basically the medical examination which will be in order to check out the pregnancy, like how can we check the pregnancy? Because the human choriogonadotropin hormones levels are increased, and this hormone stimulates the corpus luteum to produce the progesterone for maintaining the pregnancy, and also for the pre-surgical preparations for detecting different types of infections. And it also check out the disorders like diabetes, kidney disease, liver disease. If patients have abdominal pain, back pain, frequent urination, and difficulty in urination, it is also used to detect the different types of urine analysis. When the patient have diagnosis with the medical conditions such as kidney disease or the UTI infection, then doctors also prescribe to monitorize the urine regularly. Basically, it is used to detect the different types of diseases like liver, kidney disease, and the diabetes. What tests include in the urine analysis? The urine tests include color and appearances, chemical findings and microscopic findings. First, color and appearance. This is the macroscopic analysis which will be do with our naked eye. The normal urine color is the clear or pale yellow or amber color, and if it is dark or light or different colors like red, pink, then it will be show the different types of disease. Normally, and it also maybe depends upon the diseases, or if the color is different than normal, or maybe the patient is in the patient is dehydrated because of the concentrated urine. Here is the chart which will be show the different types of colors of the urine. First, clear, show that person is taking enough amount of water. Second, pale is also good. Dark yellow, indication of the dehydrated state. Orange, show that person is taking the medications like metronidazole, which will be change the dark reddish color urine from the clear. Dark orange is also it will be a sign of the liver disorders. Dark brown or black, it is a sign of the liver disorders, rhabdomyolysis or alkaptonuria. Rhabdomyolysis is a condition in which there is a damage of the muscles which is due to the injury or maybe due to the excessive exercise. Alkaptonuria is a condition in which the patient there is a not breakdown of the amino acids like tyrosine and phenylalanine, due to which the homogentic acid is increasing in the body, which will be lead to the arthritis. Pink or red, indication of the medications or maybe the foods like the beet. Blue or green, indication of the UTI infection. Cloudy is also indication of the UTI infection. White or milky, indication of the chyluria, in which there is a number of pus cells in the urine and which is due to the bacterial infection. Second, chemical findings. The doctors will be prescribed in order to perform the urine analysis, and for the chemical findings we do the dipstick test, which will be help us to determine the different types of compounds and their quantity which will be present in the urine. And how can we determine the quantity or amount of the substance in the urine? By the appearance of the color, and if it is dark, then it will be show that the high amount of that particular substance present in the urine, and if light, little bit or slightly quantity of that substance present in the urine. Strips, basically the having the pads which will be containing the chemicals that change color when they come in the contact with the specific substance. For example, a slightly color change in the test pad for the protein may indicate the small amount of protein present in the urine, while deep color show the large amount. Different types of tests we can be determined with the help of the dipstick test, like the protein urine test. It is used to determine the amount of protein or albumin in the urine. Higher levels indicate the heart failure, kidney issues like chronic kidney disease, diabetes, nephropathy, the kidney damage which is due to in the diabetes patient, high level of pressure, glomerulonephritis. Glomerulus of the kidneys are damaged and dehydrated state. Urine pH is basically the normal pH is 4.6 to 8, and if the pH of the urine is high, then it will be indicate the gastric suction, which is the gastric emptying, and it will maybe done when the patient have a food poisoning or the dose toxicity of the dose, and etc. Renal tubular acidosis, in which when the kidneys do not remove the acids from the blood into the urine, and UTI infection. The low levels indicate the diabetes related ketoacidosis, blood poisoning, and diarrhea. Ketone urine test. Ketone build up when the body when body break down the fat more than their normal range, and so due to which the number of the ketones levels are increased in the blood, which will due to which then ketones and will be released into the urine. And this is mostly happens in the patient which having the diabetes, which are not taking enough sugar or carbohydrates. Doctors oftenly provide the ketone urine test to check out the diabetes related ketoacidosis. Glucose urine test. If the glucose will be released in the urine, then it will be show that the patient having a diabetes, or there shouldn't be glucose In the normal state, the glucose should not be present in the urine, and if it is present, then it will be show the diabetes or gestational diabetes, which is occurs in the pregnant woman, UTI or kidney infection, kidney damage, or glucosuria. Glucosuria is a condition in which the glucose is present in the urine. Bilirubin urine test. Bilirubin is a yellow pigment which is produced by the liver and found in the bile. Patient having a bile in the urine, it will be indicate the bile duct disorders, hepatitis, cirrhosis. Cirrhosis is a condition in which there is a fibrous thickening of the tissues of the liver, which and degeneration of the cells, and also inflammation of the liver. Jaundice, in which there is a high level of the bilirubin in the blood, UTIs, and the diabetes. Nitrite test. The positive nitrite test indicate the UTI infection. Normally the nitrate present in the urine, which if the bacteria are present, they will be convert the nitrate to nitrite, but not all the bacteria are capable of converting nitrate to nitrite, so we cannot give the confirmation about any bacterial infection with the help of this nitrite test. Leukocyte esterase urine test. Leukocyte esterase is an enzyme which is present in the WBCs, and if the test is positive, then it will be show that there will be the inflammation in the UTIs or the kidneys. The most common cause of the WBCs in the urine is the bacterial UTI infection, pyuria, inflammation of kidneys. Pyuria is the pus in the urine which is due to the bacterial infection. And these are the microscopic examinations of the pus cells, red blood cells, and the bacteria in the urine sample of the patient. Urine specific gravity. The specific gravity of the urine normal is 1.005 to 1.030, and if the patient having a specific gravity greater than 1.030, then it will be show that dehydrated state, and if less than 1.030, then the patient is enoughly hydrated. The specific gravity test shows the concentration of all the chemical particles in the urine sample. Abnormal results may indicate the different types of health conditions like Addison's disease, in which there is a decreased level of cortisol and leads to the adrenal insufficiency. Heart failure, high level of sodium, syndrome of inappropriate antidiuretic hormones, narrowing of kidneys. This is the chart of the specific gravity, which will be indicate the different types of compounds present in the urine if patient have. So this patient have all the things then normal, except the urobilinogen levels are 3.2. These are the dipstick. This is the dipstick which will be dipped in the urine sample, and we can then compare this stick with the chart of the different types of compounds. That's all my topic. Thank you so much.